Talk to me about your plan for the NHS workforce, 350 medical school places. How will that fix the NHS crisis?
Well, this is part of a wider plan to increase the number of medical students, to double the number of medical students across our country. We've got roughly about 7,500 we train annually. We're doubling that to 15,000. So this is the first tranche of increase in places. We are targeting them to parts of the country where there's a shortage of medical students applying, because we know that traditionally where doctors train, they tend to stay. And so this is about bringing in a pipeline of extra doctors, particularly to those parts of the country where they're facing the greatest shortage.
There is a story that we are covering today, I'm sure, given your background in health. You're a former nurse, of course, and a minister now. The government's spending £1.1 billion a year on maternity damages. You spend £3 billion in total on maternity services. A third of that is going on damages. What's going wrong?
Yeah, so this has been a problem for a long time, and it's why maternity is a priority area in the Women's Health Strategy. So some of the work that we're doing is about better care for women during their pregnancy, rather than waiting till someone is giving birth to then assess their risk factors. So a number of things that we're rolling out across England. So there's perinatal pelvic health services in all parts of England will be established. We're halfway there at the moment. And what that means is that the women that are at greatest risk of having complications during birth, so maybe they've got bigger babies, smaller pelvises, babies in a difficult position, they're identified as early on as possible.
Why is that not happening already?
Well, you know, it's happening now, but it hasn't been the case for 10, 15, 20 years. And I think, you know, it's part of the wider narrative that women's health hasn't always been top of the agenda, and it is now, and that takes us a little while to get that right. If you look at the work that we're doing around maternal medicines, we're setting up centres across the country, so women who've got existing complications.
Why is that only happening now?
Well, you know, but it's making a difference.
It's been in power 14 years.
But it was happening a long time before that. It's not happening in Wales, for example, where Labour run the health service in Wales and have exactly the same experience there. But women with diabetes, women who maybe have got sickle cell, now that they're being jointly managed by their medical team as well as their obstetricians, so we are reducing those risk factors when it comes to giving birth.
But why only now?
Well, no, this isn't just now. These centres have been opening up over the last few years.
So it's cost £1.1 billion a year on maternity damages. If you were doing it previously, it's not been working.
Well, it is, because we're seeing neonatal deaths are down by 25%, and stillbirths are also falling too. So some of the work that we're doing is making a difference. Many of those legal claims will be from historical claims. They often take quite a while to get through the courts. But we absolutely want to see those being reduced. One of the key ways is by increasing the number of midwives. They're up 21%. And we're increasing the routes into midwifery as well, with apprenticeship routes for the very first time. So midwives don't have to go to university. We've also got a nurse conversion programme, so nurses who want to become midwives can do so more easily. So there's lots and lots of work in this space to try and, well, you know, it's about reducing the cost, but ultimately better outcomes for mums and babies.
And is there an apology for those affected?
Oh, absolutely. You know, I recognise as the Women's Health Minister that maternity services have not been where we want them to be. We're putting in new systems. So there's mental health support teams going in every part of England for new mums. Suicide is one of the leading causes of death in new mums. That's not acceptable. And so we're putting in those teams right now. Many of those services are operating already. I've said about, you know, some of the pelvic health services that are being rolled out, the increase in midwives. There's lots of work happening in this space and giving mums better choice. You know, the culture in maternity services was always about natural births being the best birth and not often listening to mums. Again, that's changing. And mums should be getting a better experience that they were. And often that leads to safer births and better outcomes.
Is it better to have your baby in hospital or at home?
Well, I think that should be a choice, to be honest. Some mums really want to give birth, and it depends on your own personal circumstances. Some people don't feel that they've got the facilities at home to be able to give birth. Some are first-time mums and would prefer to be in hospital. It should always be a choice where possible.
Our reporting on this found that one woman was paid more than £500,000. Could you find yourself in a position where you're paying out that much to every woman who has had a trauma?
Well, you know, I don't know the details of that particular case, and we know that birth trauma, which is, you know, tears during birth, we know that we can reduce those by about 20%. And what we're doing is rolling out what's called the OAC Care Bundle, which looks at mums during their pregnancy to identify high-risk mums of tears and birth trauma. Then during birth, putting in measures that will help reduce the likelihood of a tear.
Again, shouldn't this have been done
Well, it should have been,
Decades
but
ago.
it's this government who's done the first ever women's health strategy. It's this government that's putting in measures right now and over the last few years to get these services in place, because women's health, it was just seen as just something that you do naturally is to give birth. Actually, yes, it is a natural process, but there are many, many interventions we can make to make that process safer.
I'm sure you've been reading in the paper this morning that overweight and obese people are more likely to take sick leave. What are you going to do about that?
But again, there's a number of measures already in place that are helping with that. One of the key ones is the 60 minutes of activity in schools every day that young children now have to undertake. And that's to get them into a place where exercise and activity is seen as a natural part of your daily life. We've put calories on menus, for example, so that when people are going into coffee shops or restaurants, they can see how much they're actually taking in. We've put in the sugar tax in our drinks so that, manufacturers are now making their drinks slightly differently to reduce the amount of
Doesn't
sugar.
seem to be working.
Well, this often takes time, and so we it will take a little while to get these differences made. But we've all got a responsibility to look after our health and our well-being, and this is about giving people the tools to recognise what they're eating, the opportunity to do more exercise, and manufacturers as well to take some more responsibility about what's in their food.
What do you think about Natalie Elphicke?
Well, I was very disappointed that Natalie crossed the floor.
Did you like her?
I got on very well with Natalie, but she wasn't standing again, and I think we all recognise there was ulterior motives for perhaps crossing the floor to Labour.
Nadeem Zahawi called her a bad egg yesterday.
Well, I think it is disappointing. It's disappointing for her constituents. She had a 12,000 majority, so a large number of people voted for a Conservative MP. And I think I do have difficulty when someone just switches parties, particularly if they're not standing again, because it lets down their constituents, it lets down their local association, and actually politics as a whole. People are disillusioned enough with politicians. I don't think those sorts of political games are helpful. And I think actually it's probably backfired on the Labour Party more than anyone.
Why?
Well, I just think people think that Labour are playing games. We're busy as a government, as I said, tackling obesity, improving maternity care, turning the economy around. We had 0.6% of growth last week, higher growth in France, Germany and Spain. That's what we're focusing on. The PM's going to be talking about defence later today. Meanwhile, Labour are playing games over which MP they can get to cross the floor.
I'm sure you would not say no if Labour MPs wanted to cross the floor to you guys.
Well, we're about getting on with delivering with the job, and I don't think we actually are that interested in political games. I think it's very, very disappointing, and the public, will certainly when I was on the doorsteps of the weekend, don't look favourably upon that.
Last time you were on, finally, you said that your husband wouldn't stop smoking. Has he stopped?
Well, he's still vaping. He's still vaping.
OK, he's not stopped doing that.
He's not. No, I didn't think he would.
Do you want to pressurise him again while you're here?
No, I think I got enough stick the last time I was on. So he's got the message. So yeah.
Because vaping's just as bad for you, isn't it?
Well, we wouldn't encourage anyone who's not smoking. We wouldn't encourage them to start vaping, but it is a good tool to get off the cigarettes.
But don't stay on it.
But ideally not to stay on it. But it's better. It is better than smoking. But ideally, if you don't smoke, don't vape.